In this video, we will learn about the classification of immunosuppressants. Immunosuppressants include glucocorticoids, drugs affecting calcineurin pathway, antiproliferative agents, biological agents, miscellaneous agents. Firstly, there are glucocorticoids which act as immunosuppressants, prednisolone and dexamethasone. Drugs affecting calcineurin pathway, calcineurin inhibitor, cyclosporin, and interleukin 2 receptor inhibitor CD24 or daclizumab, mTOR inhibitor, sirolimus. Now, anti-proliferative agents under the category of immunosuppressants. This anti-proliferative agents includes antimetabolites and cytotoxic drugs. Cytotoxic drugs are cyclophosphamide and chlorambucil, and antimetabolites further have a folate antagonist, methotrexate, purine synthesis inhibitor, azathioprine, and pyrimidine synthesis inhibitor, leflunomide. Okay, these were anti-proliferative agents under the immunosuppressants. Now, biological agents. Biological agents includes the alpha antagonists, which are adalimumab, certolizumab, then interleukin 1 receptor antagonist, anakinra, then interleukin 6 receptor antagonist, sarilumab, co-stimulation inhibitor abatacept and belatacept, anti-CD3 monoclonal antibody muromonab CD3. Other monoclonal antibodies includes afalizumab, omalizumab, and eculizumab, which act as immunosuppressants. Immunosuppressants also includes miscellaneous agents which are thalidomide, apremilast, and nintedanib.